Great. So welcome again, everyone, and thank you, Dr. Khushbu, for joining us in this session today. As I just mentioned, you finished your FCAI Part 1 written exam in February. So big congratulations once again on that.
Thank you, sir.
Tell us a little bit more about your preparation. How did you start preparing for it? And
Yes.
how did you take it further? Can I ask other people, can I please request other people to mute themselves? Otherwise, this whole recording will go waste. Please mute yourself. Dr. Wajia Faruqi, can you please mute yourself? Thank you so much. Okay.
Yeah.
Yeah. Yes.
So, sir, actually, I qualified for my EDAC Part 2 in October last year, October 29th. So after that, academics had they had an introductory kind of session for FCAI Part 1 in I think in the middle of November. So I attended that. And then I was a bit skeptical because there were just 3.5 months for the February exam. So I was a bit skeptical. So I talked to Amrita ma'am that, ma'am, I have like 3.5 months for the exam. So should I sit for it or should I go for the next session? So she said that if you put in the effort, it is doable in 3.5 months. So then I registered for the exam and then I took the academics Part 1 course for FCAI. And I seriously started preparing in the last week of November. So I had started preparing by the last week of November. So the FCAI Part 1, the course which academics has, it is a very structured course and it has modules for 10 weeks. So I started preparing for that. Every week I used to they have got some hot topics for each week. So I used to do those hot topics. I used to try to cover those main topics, whatever was there. Mostly I used to read from Elizabeth Combier and James Shorthouse. But seriously, if I say that I could complete Elizabeth Combier properly, but Shorthouse was too elaborative for me. So I could only complete Elizabeth Combier completely. And then some certain topics which I could not find in Elizabeth Combier, I used to refer to BJ articles and OTW articles for that. And then at the end of the week on Saturday, I used to give the mock those exams which were there on the course. So I used to give the exam on Saturday, and on Sunday I used to refer to the recorded sessions. So there are these recorded sessions on the course. So I used to attend those recorded sessions and I used to make notes. It was a very good, I had an advantage that those were recorded. So I used to make notes of those sessions and I kept those notes. And at the end of 10 weeks, when I had completed all those, all the modules, then I had about 15 to 20 days left before the exam. So I made sure that I revised Elizabeth Combier and I revised those notes at least once. But I did not have adequate time to revise this Shorthouse. So I read Elizabeth Combier properly and those notes. And for the MCQs.
So just one quick question here. I mean, you mentioned that all your during your preparation, you were mainly listening to the recorded sessions and making notes based on that. There was very little interactive session because most of our FCI is all recorded work, pre-recorded work. Did you feel the need of interacting with someone during your preparation, or did you have someone to interact with?
Sir, I felt the need sometimes. I used to talk to Dr. Amrita whenever I had any doubt regarding any MCQ or any topic. So I used to talk to her regarding that. But as such, I was alone in my preparation. So I felt if I had someone else going through the same kind of preparation to talk to, so it would have been better in my preparation. So I missed that.
And how many hours do you think you were putting in a week, or let's say if you were studying daily, how much time were you putting in for
Sir, about 2 to 3 hours per day I used to give. because I used to work full time. So in the morning, 9 to 5, after 5 only, I used to come back, and whatever time I used to get, about 2 to 3 hours, I used to study seriously every day.
Interesting. And that you did for almost 3 months.
Yes, sir.
Very good. And you also mentioned that you had done your EDAC part 1 EDAC exam only a few months ago. Did that knowledge help you in any way? Did it give you
Yes, sir.
some?
Definitely it helped me out. Like the clinical part in FCAI, it is mostly the clinical part which is asked. So it is like a top up. You need to add more knowledge on top of whatever you have studied for EDAC part 2. So whatever I had studied already, so that really helped me out. So I had to top it up with other topics from the articles and from Elizabeth Combier. That is what I did.
Did you take any time off from work, especially closer to the exam?
No, sir. I took about 2 to 3 days leave before the exam, so that I could revise whatever. Yeah.
Yeah,
But
I certainly remember in my case when I was doing the exam, I took almost 2 weeks off. Didn't have enough knowledge and enough revision time, so I had to take quite a lot off. But you've done well to have only 2 to 3 days to be able to revise.
I had one advantage, sir, that on Saturday and Sunday we get like adequate time. I get full off on Saturday, Sunday. So in the morning of Saturday, we just have a class, academic activity we have from 9 to 1. So after that, the entire day I used to get free. So I used to utilize Saturday, Sunday properly.
And how did you find this online exam? Because you sat it online. Was it were there any challenges in terms of technology, in terms of how to type so quickly, and how to maintain that rhythm?
So you have to type very fast, and like you can't copy paste from whatever you've written. So sometimes in the exam, like when there are sub parts of each question, so many a times you will find that like the second question has got some points repeated from the first one. So you can't copy paste from the first part to the second part, whatever you've written. You need to type everything again. So you need to read each part carefully before attempting that question. So that is one point. And the practice sessions, like whatever I used to give on the weekends, so they helped me a lot to increase my speed. Because initially, I remember in the first 1 to 2 weeks, I was not able to complete the exam within the time limit because my speed was less. But with the third and fourth week, I used to be able to complete the exams within the time.
And correct me if I'm wrong. I believe that it's very important to see the whole from the main stem, see all the sub parts of the question, because sometimes you may answer one section at the beginning and the same thing is being asked later on. And then you might end up losing time and repeating yourself. So it's always important to see that. And always, I think marks, checking the marks is very important. If it's a 2-mark question, write only.
And you have to be very to the point. You will not get extra marks for writing too much. You have to be to the point. Whatever they have asked, you have to write only that much. And definitely what you said, sir, that they will repeat the same thing after 2 to 3 questions. So before attempting any long question, you have to read all the parts properly before going for answering.
And do you think the Academics FCAI 1 course completed your curriculum? You thought there were certain things which were not covered, which were asked in the exam, or certain areas of anesthesia which were lacking, or you think what was your experience?
Sir, I felt that about 80 to 90% of whatever was asked, it was covered in the hot topics which were given. And the rest was covered in, like I did walk Dudley for the single best answers. So I felt that whatever 5 to 10% was left, it was covered in that small topics. Yes.
And were there certain sort of questions which you thought you felt that were picked up straight from the course itself? Were there some?
Yes, sir. Yes, sir.
Yeah.
There were.
Because we often find people saying, oh, 30%.
Because I remember, so there was one question on flap, like on flaps. So there was a question on modified radical mastectomy, and then they had given that like premise of that of a case, and then they asked in subparts about flap. So what are the factors responsible for flap edema? How can you prevent that? So that was like, this was completely discussed in one of the discussions, recorded discussions of FCAI course.
And how does the scoring system work in FCAI? Can you tell a little bit about to your viewers? How do they score you? And what is this Angoff scoring?
Yes, sir. So there is, they use this scoring system known as the Angoff scoring for FCAI. So what they will do is they will compare, so it is like a comparative score. They will compare between different candidates, how they have fared in that particular question. And then they will decide that what will be the passing marks for that particular question. So it does not matter if you have not been able to answer the question. So if your fellow candidates, they are also not able to answer it. So you don't need to worry, because like it will be considered to be a difficult question overall. So the passing marks for that question will be automatically reduced. So.
Great. And one of the candidates has asked about single best answers. How did you find the single best answers? Were they tougher than the SAQs, short answer questions?
So some of them, like I felt that 60 to 70, they were like easy to moderate grade, and like the rest, I felt them to be difficult.
Any specific strategy you employed to address the SBAs or?
So like when I read the, like if I felt some question to be difficult, I just flagged it. And then I came back to it at the end. And then I spent some time to, I just tried to eliminate whatever I could. And then at the end, whatever was left, that is what I marked. So, but in single best answer, that is the problem. Like each and every of the options seems that it is the right.
And do you think a lot of practice of SBAs helps, or is it just having enough knowledge that is eventually the main factor?
So practice also matters, because like I even in the FCAI course recorded sessions, like when the SBAs are discussed, so ma'am and like Dikshita ma'am and Amrita ma'am, they used to teach us the like it is, you can kind of strategize how to eliminate the options. So using that strategy also, sometimes, like even though you have read the question, the particular topic, but still you will feel that most of the options are right. So by strategizing, you may be able to eliminate the options.
And tell us one single best thing that you find in your preparation, or single most useful practice that you found in your preparation, which you would like people who are preparing for the exam to adopt. Anything be it your study hours, be it your time of any particular book, and be it any online subscription. Yeah, please mute yourself, guys. Guys who are just guys who are just joining in. Yeah, thank you so much. Yeah, tell us about your any single most important thing that you feel that you found very useful.
So the recorded sessions, I felt that they were really helpful, like making notes of those recorded sessions and then going back and revising them. Really
people will think this is a setup question, but other than the
no, sir, it was really helpful for me.
Other than the course, anything else you found that which in terms of books or in terms of study habit, anything that you found, any other online resource other than the academics work that you found?
So BJ articles are really good. And even in the MCQ book, I felt like Bogdadli is a very good book for the SBAs.
I see. Sure. And any book you would suggest for SBAs?
Sir, like I did not have much time, so I did Bogdadli properly, and then when I had just 1 to 2 weeks left for the exam, so I had a talk with Amrita ma'am. So she suggested some like there are some 900 to 1000 MCQs in BJA. So she told me to go through them. So I did not have much time, but I just went through them. They also helped me.
Perfect. Perfect. Okay, great. Well, that's lovely. I think you've given a good insight. I'll open the forum now for all the other participants to ask questions that they have. Please feel free to unmute yourself and ask question in person, because then this will be recorded, and your questions will the text that you're writing may not come in this recording later on. So please feel free to unmute yourself and ask the question to Dr. Khushbu.
Yeah, thank you very much. Good afternoon.
Good afternoon.
Yeah, and congrats again. Please, can you just give us a summary of the first part? How many questions do we have? How many sessions, and then how many hours? Just a brief summary.
Okay. So actually there are 4 sessions. So first session, so there are total 10 SAQs. So in each session you have 5 SAQs, and each session lasts for 90 minutes. So 4 sessions of like I think I don't remember it properly, but like SBAs you get 60 minutes or 90 minutes. I'm a bit confused right now. But for SAQs, each session 5 SAQs are there, and you get 90 minutes for each session, and there will be a break of around half an hour between the sessions. So total 4 sessions are there. So first there is SAQ session, then a SBA session, then again one SAQ session, and then the SBA session.
Thank you. Maybe this is for Dr. I'm not sure. For this, the MCQ part now, the multiple choice questions.
Yes.
I don't
total
know.
I remembered it now. So total 90 MCQs they had asked, SBAs, and in each session there were 45 SBAs.
Oh, okay. All right. So that was what I was asking concerning if there's any. I know academics also does that, but
Yes.
if there is any other result apart from that for one to go through, because all right. So I think I'm fine. Thank you. Thank you. Congrats again.
Thank you.
Any other questions? Any other questions, guys? Feel free to ask. This is a very good opportunity of candidate to speak to a candidate who has just passed the exam. Yeah. Please fire away.
Hello.
Yes, please.
Yeah.
Yes, madam. This is Dr. Rashid from Pakistan.
Yes, sir.
And I have a question that in our setup, the fellowship exam, basically it's MCQ based. We don't have any short answer questions or short essay questions.
Okay.
So what amount of time or what preparation do we need for the SAQs? And secondly, it is computer based exam. So what should be our typing speed and how much fluent we should be in writing? Because it's not handwritten, it's online.
Yes,
So kindly
definitely.
you can write.
So like for SAQs, what I had done was that I did those, there is a set of hot topics in academic. So I used to try to cover as much as possible of those hot topics within 1 week, like from Monday to Friday, I used to cover those. So from Elizabeth Combier, and like whatever topic I used to not get, I used to refer to BJ articles, or like there are very excellent articles on ATOTW also. So I used to refer to that. And then like at the end of the week, I used to give those, there are mock exams at the end of on academics course. So I used to sit for those exams on Saturday. So what on that exam, you will get a like hang of the writing speed, how fast you need to write so that you can finish it within that stipulated time. And that will really help you, like trying to write within that particular time. So initially, as I already told, like I was not able to complete it within that time. But as the time went by, my typing speed increased, and then I was able to complete it.
Thank you, madam.
I think some questions have been asked again. I'll just, for the sake of completeness, I'll ask them again.
Yes, sir.
Dr. Tejal has asked for a list of complete set of books and the ideal amount you need to time to prepare for this exam. And some other people have asked for a guide for MCQ preparation. And yeah, but feel free to unmute yourself and interact. That will be a lot more easier.
So in the books, I would like to say, like we can, if you have got enough time, so you can, you should definitely try to cover Elizabeth Combier, and James Shorthouse is also a good book, but I didn't get enough time to complete it. Then like those BJ articles, if you don't get those topics in Combier, you can even on like academics course, they have added some PDFs of important articles, so you can go through that also. They are also important. And for MCQs, you can go for you can complete Bogdadli and BJ education MCQs. That should be enough according to me. And if then you have enough more time, then you can read something more. But this much at
Madam,
least. Yes.
sorry, one more question. What amount of time is required for preparation? Like the next written exam is on 2nd October, I guess. Almost 4 months. So is it enough for preparation, or should be out for next year attempt?
No, like if you can put in at least like 2 to 3 hours of study every day, and you can like there are 10 modules on this academics course. So if you are able like you for one reading you need at least 10 weeks. So and after that whatever time you get, you can revise those topics. So what I got around 3.5 months for my preparation. So I think 4 months is quite doable if you start seriously from now.
Thank you.
Ma'am, for learning typing, have you used any separate software to increase your typing, or generally you
No. I practiced on my laptop, on the keyboard of my laptop. I didn't use any special software.
Which part is easier, ma'am? Is the MCQ part is little easier as compared to SBA?
Yeah,
or...
I felt the MCQ part to be easier, but the thing is that like it is a like all the options will seem to be similar. It is the single best answer. All the 5 options, they will be right, but you have to choose the best amongst those 5. So that is the challenge over there. So even though you feel that like I know this and I know this topic, but it may not be the right answer. So at the time of giving the exam, I felt that MCQs were easier.
Okay. There is no negative marking, anything?
No. It's the Angov scoring.
Angov score. Do we need to
And
clear
is it percentage based or percentile system, madam? And what is the required mark? Like it's 60% and above, or what is the criteria?
They will again, it is that the Angov scoring is there, like depending upon the performance of whatever number of candidates have given the exam, they will decide the cutoff. So you need to get more than the cutoff. Like I think in case of MCQs in my time, it was 67% out of 100. So 67% was there. So you should get more than 67%, then you will pass. And in SAQs, it was around, I think 55% or 57%, like that. So depending upon how difficult the candidates found the exam to be, it will be changed. The percentage will change. It will not be same every time.
Oh, thank you.
And this EDAC notes and books, what we have read has to be revised, or this whatever the books you told is enough? Because
actually this exam is mostly clinical based. In EDAC part 1, we had read like all the basic sciences. So basic sciences is not asked much, but whatever knowledge you have of the basic sciences, that will definitely help you in answering some of the questions.
I have done little earlier, 2 years back, EDAC, but
Okay.
this academic course, whatever the content required is given in that for
Yes.
this.
Yes. In the course, like there are 10 modules given in this course, and each week, so in 1 week, you have to complete 1 module. So
Okay.
they have given hot topics for each week. So you need to cover those topics as much as possible. And then there is a mock test at the end of the week. So you will appear for that mock test. In that, you will get your typing practice. There are some MCQs as well as SAQs. And then they will discuss the answers for that exam. And I think in my session, because there were not many students, so I didn't get the interactive session. I think in this session, you may even get the interactive session. So yeah, each week you may get to interact with the teachers regarding the questions.
This exam, part 1, we can give n number of attempts, or up to the 7 years from the EDAC, like that.
Yes, up to 7 years. Yeah.
And it happens in 2 sessions. One is on February, another in October.
In October, yes.
Once you clear that part 1, February, you will have again have to appear for part 2, a kind of for the clinical.
Today, I gave the exam in February 28th. My exam was on 28th of Feb. And they take about exactly 1 month to take out the results. So my result came by March 29th, like that. Okay. So this, part 2 was in April. So I could not apply for that.
Okay.
Yes.
Then next part 2 will be this October you appear.
Yes, it is in December. It is in December. Yes.
Entire full day, the exam starts by morning 9 o'clock or London time?
In London time, it will start in the morning, but in India time, it is like in the afternoon. So it went till 10 in the night.
Same like EDAC.
A long exam, just like EDAC part 2.
Ma'am, if we have cleared FCPS, then part 1 of FCAI is exempted. Is that true?
Actually, ma'am, I'm from India, so I don't have much idea about the courses.
Yes, ma'am, exactly. It is like if we have done fellowship from Pakistan, then MCI is exempted. We can directly apply for FCAI.
Okay.
And
no, this MCA is a separate exam. That is a qualification for FCAI.
No, we have to give FCAI part 2.
As much as I know, like the eligibility for FCAI part 1 is either MCAI or EDAC part, like EDAC part 2 cleared candidates.
Okay.
Yes.
MCA is an MCQ based exam, single best answer questions, or I didn't know.
I think there is Viva also in that.
Okay.
Yeah.
And how about the clinical questions? Is same like an EDAC level tough or little higher?
It is higher. It is higher. Definitely.
It is higher.
Yes. It is higher. They are asked in depth.
In depth. Okay.
Yes.
It will be on case scenario basis, like a clinical case in depth.
Yes, they will give us
like
a short scenario.
You told, no? So they will ask about the mastectomy. They will ask about the flap. Apart from anesthesia management.
Yes, then they can go into regional also. They will ask like what are the pain relief options in this patient.
Okay.
And they can also ask about some recent studies also. Like they had asked about CRASH 2 trial.
On tranexamic acid.
Yes. Okay. So they can ask anything. Then they can ask scoring systems also.
Oh.
Yes.
Like tumor scoring systems, or is there like frailty or this?
No, directly they will not ask you to like tell the scoring system, like they can ask what scoring systems do you know which can be used in this like that. So you should know all those things also.
All this scoring, everything is there in the Elizabeth Combier and this package, no? Academic
Yes.
materials, whatever. And every week, this assignment you used to complete in that week. And
I used to try to complete, but
Saturday
sometimes I could not. But
and
I
how do
tried
you
my
carry
best.
over and how to manage if the leftover topics? Because once you start, you have a 10 weeks of program, no packed program.
Yes.
So every
You have
week
to accommodate in the next weeks. Like certain weeks, there will be less number of topics.
now, if you not able to complete in a first week, and you can skip the second week topic and complete the first week topic and go for the next.
But then you will
it
get
be
behind. You will get behind in your preparation. So what happens is that like it is divided there are modules. So one is cardiovascular surgery, one is gynecological surgery, obstetrics, then there is pediatric anesthesia, intensive care. So in certain modules, there will be less amount of topics to cover. So what you can do is whatever topics you are not able to cover earlier, you can cover those in those weeks.
Those weeks.
Yes.
Whenever the topic volume is less, we can match it with the leftover one.
Yes.
Ma'am, can you please repeat the SAQs books and MCQs book again, because I missed that part.
Yes. So Elizabeth, for the SAQs, you can do Elizabeth Combier, and I would recommend to do it properly because it is a very good book. Like a lot of questions came from this book. So Elizabeth Combier, then there is James Shorthouse, and then BJ articles and ATOTW articles, whatever topics you're not able to get in these books. And for SAQs, there is Bogdadli, and there are BJ education MCQs, around 900 to 1000 MCQs are there. So you can go through that.
Are these books available in hard copies as well?
No, you can get a PDF of these books.
Okay.
You can get a printout of that PDF. I got a printout of Elizabeth Combier and Shorthouse.
Okay, then we can. This October is doable, or
yes, it is doable because you have time now.
And how
but
to
you need to keep practicing and you need to be consistent. That is what I would say. Yes.
But little more intense as compared to EDAC.
Yes, it is. It is intense because it is a higher level exam compared to EDAC. Yes.
I have a question. Can I ask?
Yes, sure.
Actually, I gave last year, I think in February session.
Okay.
And I lost it I cleared the MCQ part, but I didn't clear the short answer because I couldn't manage the time.
Okay.
Because I left one of the questions. And in most of the questions, I felt short answers were okay, but MCQs were a little tougher. It was more of a diagnostic and clinical approach. And they had asked about a lot of echo finding.
The questions are very practical. Yes.
And they were asking about more of how do you manage hemodynamics based on the TE report. Because I'm not used to it. I'm not done cardiac that much background I don't have. Only whatever standard cases like mitral stenosis, aortic stenosis, basic things I knew, but I couldn't answer most of the questions. So how did you tackle those questions? Whether this type of questions were covered in academic course?
See, there will always be like some questions which will be like difficult. I am quite sure that whatever questions you found difficult, they must have been difficult for all the other candidates. So in such questions, you will get marks, even if you're not able to write get the right answer. That is what is the angle of scoring. So you don't need to worry about these kind of questions because definitely others will also find it difficult. So you should concentrate on the easy questions, because if the easy questions you get get them wrong, then you are likely to lose marks.
And one of the question I knew the question because they
Okay.
had framed it in a different way. They
Okay.
said osseofacial osseofacial. How do you classify osseofacial components? So I
Okay.
was not knowing what is osseofacial. Maybe something to do with. But later I came to know they were asking about compartment syndrome.
Okay.
So I felt it little difficult, maybe. In that short time, you have to
This is
answer all these
something which
questions.
others must have also found difficult.
Okay.
Yes.
Karan sir,
in
in your experience, no, that is there a majorly, it is only a clinical one, anesthesia management, they are not asking too much. How do you go
Yes,
ahead?
they are asking. They are asking. They will ask, there will be long questions on these, like subparts. They will ask, what will be the anesthetic management of this case? So they will allot around 6 to 8 marks. So you have to be very strategic in these kind of answers, because you have a lot to write in such answers.
Yeah.
So you have to be very strategic in such.
Like pre-op, intra-op, evaluation, investigation,
Yes.
like that. We have to write
Yes.
in a headings and only bullet points as.
Yes,
we
bullet
can-
points. Yeah.
Kushbu, and I'll ask you one question. Like, I got a question like this. So it was more of a daycare anesthesia. So the
Okay.
patient came with a not a known previous history of high BP, not a hypertensive, but now the patient has come for an anesthesia, some minor procedure, some carpal tunnel release.
Okay.
So they had asked, now the BP is very high. So how do you go about this? So there is any guideline, anything you would, based on that, like NICE guidelines, or you follow that and you take the case, because it was like more of a what you do. The question was all
Okay.
about.
Yes, you have to write it according to guidelines. If you can remember, or you can also write I will try to control the blood pressure first. I will try to get it under control, and then I will take the patient up for the surgery. And if you're able to write, you can mention some guidelines, then you will get more marks.
Because in the first question only, they told classify hypertension based on NICE guidelines.
Okay.
Then they asked about the management.
Yes. So you have to write how will you manage? You in such questions you have to mention the drugs and what dose you will give. They are particularly asking for that part.
And
Thank you.
one thing you are telling, no ma'am, copying is not allowed. So in a single question, there will be, in my understanding, there will be 5-6 sections.
Yes. So many a times what happens, like if they have asked that question, the answer in first part, similar kind of answer will be there in the 4th or 5th subpart. So you need to write everything again. You can't copy that initially what you have written. That is what I meant.
But in that case, how to manage, or whether to leave the answer in the first part and give that the 5th section, or we have to write it there itself?
No,
here
you have
also?
to write it again. You have to write it again. And that's why like if it is a repetition and or the second part asks for that thing particularly, sometimes you will, even if it is not asked, you know it. So you will keep on writing. So you should not do that. So before attempting the answer, any question, you should read the sub questions so that you are not writing unnecessarily in the initial parts.
We might think that this little extra point will give some.
It will not. You will not get extra marks for that.
But that will be asked in another section where you have to write it again.
Yes.
So that will be a waste of time. Okay.
Yes. That's why you need to read all the questions first properly.
And regarding time management, as far as this SBAs will, this SAQs will have a little less time.
There are 90 minutes for 5. So it comes to around 18 minutes per question. So you have to
be fast.
Yes, you have to be fast, and you have to keep it in your mind that 18 minutes are over. So I need to go to the next question.
So each question 18 minutes is allotted.
Yes.
Okay.
It's not a lot, but you have to be fast enough to complete it within that much.
No, I'm asking whether the typing and the content is same for each question, which will take away 18 minutes, or some question will be we can spend a little 5 minutes itself to complete the answer. And
Like if it is 2 marks or 3 marks, you should not spend much time. Just write it to the point and move over. Like I told, they can ask anesthetic management. So that will be for 6 to 8 marks. They can allot 6 to 8 marks to such questions. So you have to give more time to these submarks.
it is
Sorry
mentioned
again,
that how
can I
much
know the
syllabus-
MCQ books which you just told? Name?
Yes.
And the BJ
So,
education.
there is Bogdadli. There are 300 single best answers. And then you can also go through BJ education MCQs. These are around 1,000 MCQs are there, I think.
Okay. If you don't mind, can you just type in the chat box the name?
Yes, sure.
Thank you so much.
In between, we can move around from the computer, no? And can we study, or in between the breaks, like 1
In
hour?
the break, you will not get much time. Just like half an hour you can get in between. So
Okay.
like
Just to
refreshments.
refresh and come back. Okay.
Yes, you will not get much time.
So just a question. FRCA materials, are they helpful?
Can you repeat once again?
Yeah, I'm asking if FRCA materials are helpful here, like final FRCA materials.
Yes. They can also be read. Like we had those podcast scripts for FRCA. They can also be read. The part 2.
Okay.
Final FRCA podcast scripts. They are also helpful. If you're able to cover, you can cover that also.
Okay, thank you.
I think there's a recurrent question that about FCPS. So
Yes, sir.
let me just clarify this to people who have done FCPS. You are exempted not from FCAI, any part of FCAI. You are exempted from MCAI. So before, in order to sit FCAI, you have to sit MCAI, and that's a membership exam. But if you have done FCPS, you are exempted from that exam. You can straight away go to the written part of FCAI, but you still have to write FCAI first part and second part. I hope that clarifies the doubts. Any other questions, guys? Are BJ MCQs available in PDFs? No idea. Did you get them as PDF or? No, I think. Feel free to unmute yourself, guys, and ask the questions.
So, sir, how to join the academics course for preparation of the FCAI exam?
And how to
Yeah, go ahead, please.
How to apply for the exams? FCAI is in the website. We have to directly register and upload our EDAC certificates, or
Yeah.
how do they?
Plus, you have to get a signature of, get evidence of, I think, your training and all that aspect. If you have had your basic
Yes,
training.
sir. So there is a printout available. So you can get a printout of there is a document. So you need to get it signed by your head of department. So it will certify that you have undergone 36 months of training in anesthesia. So you have to upload that and then your EDAC certificate or MCAI certificate.
It's either training or experience.
If we have completed our anesthesia and we are working, will that the certificate is needed, or our department HOD has
Yes, department HOD, wherever you're working, like your head of department's signature is required.
So it's just to clarify, it's not just work experience that is important, that is relevant or that is needed. If you say that I've worked as an anesthesia resident somewhere, they won't accept it. They want the specific word training, that you have had 3 years of training in anesthesia. So be very particular that you get that mentioned in that certificate.
So after uploading these documents, they will review your documents, and then they will send you an email for the payment link. So first you have to upload these documents. They will take about 2 to 3 days to review your the authenticity of your documents, and then they will send you a separate email.
Yeah. Any other question? You were asking something, Doctor.
So this one, we finished MD program and in India, and we were working as a consultant in a hospital for
That's
3
enough.
years.
That's enough. If you have, at any stage, if you have done training, that is enough. You don't have to be a recent trainee. At any point in your career, if you've done 3 years of training as MD or DNB, that is enough.
That institution which we studied has to be mentioned, which were
yeah.
But the sign has to be get from that HOD or current our working hospital HOD.
If you're working,
sorry, your voice is broken.
Has been a...
Pardon?
Can you hear me?
No, sir. Can you repeat, please?
I'm saying if your current HOD or your supervisor can sign and you attach your degree with it, that should be enough as well. But make sure anything you do in terms of your paperwork with FCAI, do it well in advance. Sometimes there can be delays in the process, and you don't want to lose the very important time in your application. You don't want to miss the last date.
Okay.
Okay, I think the questions are dwindling down gradually. I think we've probably answered most of your questions.
Sir,
I hope.
Excuse me, sir.
Yes, Dr. Rabia, please go ahead.
Yes, I just want to ask that if I have switched the hospital, like I have been promoted as an consultant anesthetist in another hospital from the hospital where I did my training. So in that case, I would have to go back to that hospital and ask for.
If you have FCPS, if you have FCPS already, put your FCPS degree. And your current hospital person will do, because for FCPS as well you would have done at least those 3 years of training anyway at some point, so that is enough.
So I just need the FCPS degree and the signature of the HOD of the current hospital on that.
That's correct. Yes.
Okay, thank you.
If I am supposed to be the HOD, can I sign for myself, or I'll ask my colleague to sign?
Ask your colleague to sign. Ask your colleague to sign. It would look nicer. It wouldn't look nice if you're certifying yourself. I think you guys have had most of your questions answered. To have more any further questions answered, contact us at any point. We are very accessible. And if you want to join the AK Medics course, you have Jitesh's number, or you have my number, or you have the link in the chat. Save the link that has been shared earlier. You're most welcome to join the course. Make sure the course should be joined well in time. You don't do it at the last moment, you won't be able to take advantage of it. Join it at least 3 months before your exam, so you can do the sessions at your own time and with your own speed, and get the maximum benefit out of it. I think with that, we will conclude today's session. Is any of you sitting the Viva at any point?
Sir, I am planning to sit in December.
Oh, you plan to set? Okay.
Yeah.
So I think we were supposed to organize a talk with Dr. Arshi.
Hershey.
Yeah, and is Dr. Arshi. Dr. Arshi, you're in. Perfect. Let's move on to the next stage. Now, Dr. Khushbu, you ask questions to Dr. Arshi about her Viva experience, and the rest of you can just sort of chip in as well if you have any questions. I know you're sitting the written exam, but this conversation will certainly help you in getting your preparation underway. So over to you, Dr. Khushbu, and Dr. Arshi, please unmute yourself and welcome to the session. I introduced yourself earlier. I think you were about to join at that time, that you are working in Ireland, and that
Yes.
you have recently passed your Viva exam in the first attempt, which is a great achievement. And welcome to the session. Dr. Khushbu will, I think, now ask you questions about your Viva preparation, and we'll start it. We'll take it from there. Dr. Khushbu, over to you.
Yes. Okay. Thank you so much, Dr. Danish and Khushbu. Congratulations. Same to you, ma'am. Congratulations for clearing part 2. Thank you. So,
Yeah.
ma'am, I would like to ask you, like, when did you start preparing for the Viva? How early before the exam?
Actually, my scenario was that I cleared my theory exam in like October 2023 attempt. And then the immediate after that, the Viva was after 1 month, but that attempt I didn't go for
Yes.
that. So the serious study that I started was from January.
Okay.
Before that, I was just randomly, reading books, but I know myself that that was not very effective because I had this thing in mind. Okay, it's been like 6 months after that Viva. So the serious study is after like from January, and honestly speaking, my actual preparation for Viva started when I joined the Viva session from this group, academic group, because before that I had this thing in mind that I have done my theory, and it will be very easy to prepare for Viva. So I'm like in a good position like this. But when I started taking session, then I realized that it's not that easy like theory, because in theory we are more focusing that what we are able to write after reading. But in Viva you have very short time in which you have to comprehend and you have to show whatever your knowledge and skill is. So I would say in short that 3 months of very good.
Intense
Yes,
preparation.
yes.
Okay.
So that's the thing. And
Dr. Wajiha, can you please mute? Thank you. So, ma'am, what all books did you refer for the Viva?
yes, so for books like the books you mentioned, honestly, Elizabeth Combir, the new edition, that is the second edition, is it has everything in it.
Everything, yes.
Yes, because I started with the first edition, but then in January there is a new edition came, and then I switched to the new edition. But again for Viva, just like theory, again for Viva also, I would suggest that for me, that is my personal experience, that one should have a parent book, in hand.
Where you
Okay.
can
Yes,
refer
because the
everything.
thing is, in these Viva books, somehow, uh, because they miss some of the topics, because you cannot be sure that, they are covering each and everything. But yes, they give us a very good idea that what type of questions will come. Okay. So my parent book was Oxford. Okay. So I really love Oxford. I read it for the theory also, and for Viva also. Oxford is also always beside me. And then is the Elizabeth Combir. Honestly, I didn't go for so many book like people. If you go to the site, they have multiple suggested books like James Shorthouse and Simon
Yes.
Wigner, and even there is a book Madonica,
Medonka.
Medonka something, but
Yes.
I was not able to review everything. So my main book was Elizabeth, and then topic wise I print out articles, guidelines, and I make folder of these articles and guidelines, especially like NICE guidelines, and some association of anesthetists guideline regarding anticoagulants and antihypertensives, and then uh, uh, and also like if I will tell you shortly about the viva, the structure, they expect you to tell it, like even the classification of drugs. Okay, so what I did, the main classification I take out, print out in like pictorial way, so it was easy for me to remember that. Like for example, I had a pile of like in which I like the classification of oral hypoglycemic in one paper, so that I always revise from that. Okay, and I added up things with added up extra things, side effects and perioperative, like when to stop, when to start. Similarly, the drugs for chemotherapy drug, immunosuppressant drug, because they are all very favorite question in viva. So the for the material, I would say have a parent book. For me, it was Oxford, then Elizabeth Combeer, and then make a pile of different prints, topic by topic.
Okay. So how did you find the academics viva sessions for the preparation, ma'am?
So that was very amazing, because when I took first session, it was just like a trial, because I searched on the net that FCAI viva session preparation, and then I saw this group. I didn't know it
So you didn't
about.
take the take it for the part one. You didn't take.
No, no.
Okay.
Back actually, my FCPS, I am from Pakistan. My FCPS is like 10, 11 years back. So,
Okay.
so for me, it was a, kind of start from, I forget everything, if
Starting
you are,
from
yes,
scratch. Yeah.
stretch. So, and in between these, after my FCPS, I went to Saudi, then back to Pakistan, then back to Saudi, and then I ended up in Ireland. Then and here I gave this theory exam, and then after that Viva. So, so I took this Viva session initially for trial, and my first Viva was by Dr. Amrita, and then the journey started from there.
Okay.
Because the Dr. Amrita's grinding viva, and then I realized that where I am, because I was not able to answer properly, even though she asked me simple, I don't remember exactly, some pediatric scenario, and I felt, oh, I know that I can answer it very easily. But the rapid fire thing,
Yes.
because
You will not get much time to think.
yes, because uh, you have if you are not in practice, even though you know a topic, uh, like I would like to like I will tell about the structure of the viva, but the thing is, like, it's in 6 minutes, one topic, 6 minutes, and in 6 minutes they ask around 8 to 9 or even 10 questions. Okay, so now it's up to you, like how
Much
many,
you
how
can
many,
answer. Yes.
and how quickly you can answer, and how intelligent you are, that don't waste time in giving one answer. For example, if they are asking you that for example, they ask you what is the incidence of rheumatoid arthritis, okay, and you don't know it. So rather than wasting time, or so you are wasting your time. Maybe this question has only 1 mark, okay,
Okay.
and then next question has more mark, and in the end maybe they will ask you about the anesthetic management, that is main question,
Main
and
question.
that had like maybe 10 mark. But if you waste your time in explaining little things, and then by the time they reach to the anesthesia management, in which you are very fluent and you can answer very well, and your time finish, and they move to the next question. So that's the thing. So when I
So
started,
what should you say in such a scenario? Sorry, I don't know.
for me, Viva is like a recipe. Everyone has his own recipe. So when you will prepare, you will be, by talking to different colleagues and by your own experience. For me, I whenever I read a topic, important topic, I write incidences in a separate page so that I have a collection of incidences by the end of my preparation. Okay. Then I realize that some cases, like some incidences, are very common and some are less common. So we can always generalize our answer, like 1 in 1 million. Okay,
Oh.
1 in 2, or sometimes we just say it's very rare. But
Mhm.
some things are very common, like epidural puncture, yeah, PDPH. So for that you have to be very specific. Okay, you should know that. But like, and similarly, like for pyloric stenosis, 1 in 400 in male, like this. So there are some incidences which are, very important. You should, remember. But there are other, they are rare, so just generalize them, like 1 in 10,000, 1 in, like this. So I make my mind like, but fortunately I wasn't asked any question about incidents. But the message is that for Viva, practice is very important. Even though you are champion in some topic, you are champion in, diabetes management or regional anesthesia, or you have very strong grip on ICU. In the Viva, the main thing is that how quickly you understand the question, how quickly you answer, and if you don't know the answer, how you manage the situation to drive the examiner to the next question. Okay, because if you are sticking to one question, okay, sometime examiner drive you, but sometime examiner will not drive you. Okay, and you are wasting your time.
Okay. Okay. So, ma'am, how many Viva sessions did you give, and how often did you appear for the Vivas?
For Viva, I booked for, I think I booked for 12 Viva, then I added 3 Vivas more. So total of 15 Viva in 3 months.
So every week,
Every week.
every week, one Viva every week.
Every week, one Viva. Okay,
Okay.
and that Viva is very comprehensive, like it's like on exam pattern. One Viva means, you can say one Viva means 25 minutes. One Viva means one station, you can say.
Okay.
Okay.
So, like the topics were divided for each Viva, or you used to study all topics for each week?
Actually, initially the idea was that okay, we have gone through the
Entire
theory.
course.
Yes, entire course theory we have done. So initially we thought that we are able, without dividing, we are able to give Viva. But in the end days, like last 1.5 month, so we divide the course. But I will suggest it's better. It, first check yourself, where are you. That's very important. Okay, check yourself, where are you, what are your deficiencies. Okay, and then it's better to divide the course grossly, not in a very little part. Okay,
Broadly.
grossly, like three parts divided, and then give Viva, and before exam, like 2 weeks or 3 weeks back, give one comprehensive Viva in which you cover, all the things.
So, did you take any time off before your final Viva exam?
Yes, 1 week off.
Okay.
1 week off before Viva, but before that I had very tough duties here, and I was mostly posted in ICU, so ICU calls and everything. So it was quite difficult, but you have to make a planner. Like when 3 months are left for Viva, you have to be very serious. You have to make a planner, and you have to divide time, that when you are at home, at what time you will study, at least 2 hours.
Okay.
Okay, so no
So you
matter
used to
how,
take out 2 hours every day to
2 hours, yes. Yeah.
Okay.
I can
I-
I can I can just jump in here. I can see that there is a very you are very methodical in each part of your preparation. I mean, from you're making your notes, you had made separate sections, separate collection of topics separately. In terms of your Viva preparation, you had done very methodical practice and strategy and putting the resources together. That I think is a very significant part. If you have a plan in place in which you are very specific on how you will do things, and with the view that when it comes to the performance on the day, all this planning will come together and help you out. I think that shows that you were thinking well in advance that it is going to be a tough exam. I better plan for it from the day one actually. So I think I can see that clearly in your conversation.
Actually, the thing is, Dr. Danish, as I said, one has to know his or her,
Limitations.
yes, limitations, and that though for me, I had this thing in mind that it's been long time. I was it it's been long time I hadn't given any exam, so I
Attending one lecture.
Sorry. Yeah. Please carry on.
okay. So I customize preparation like for myself. For me, I memorize thing. Remember once you send a picture of Dushini's child, we were doing one Viva session, and you send us a picture of Dushini child, and then to memorize that what will be its features. So that gave me an idea that I should take out pictures of all the particular disease which have specific features. So I make a folder. So for rheumatoid arthritis, I take out a print. For my this Duchenne, then this myotonic dystrophy, and with for different scenario, I take out a print with a pictorial presentation just to memorize. Because in Viva, I would like to say, like usually when we are studying, we are focusing on anesthetic aspect, but when they start Viva, they start from definition, okay, and they start from sign and symptoms, and then the medications and their classification. So if you do not have grip on the clinical features of the patient and the medications and the definitions, and then by the time they reach to the anesthesia management, you lose your confidence, because you miss, for example, if they are starting from diabetes and they ask you what is diabetes, okay, and then what are the clinical features, and then what is the classification of insulin, different types of insulin, and oral hypoglycemic, and you are not able to answer that. So by the time you reach the anesthetic management, your time is lost and your confidence is also down, because you have missed initial question. So whenever read any topic, study any topic, have grip on that you can you can answer everything about it, from definition, from guideline, from medications, and uh, you should know something about everything.
Okay.
So that's the thing. If I will like to tell about the structure. So the Viva, there are 3 stations. Okay. And the first station on perioperative medicine, patient optimization, and data interpretation.
Okay.
Right. So in a first table usually start by giving you some report. It can be ABG, it can be some blood report.
First
Okay.
station.
Sorry.
Ma'am, can you please repeat first session, because your voice was breaking. How many
Okay.
stations, and then?
So there are 3 stations. Okay. Each station for 35 minutes. So 35 minutes, then a break, then 35 minutes, and then 35 minutes. So there are 3 stations. The first station is on perioperative medicine, patient optimization, and data interpretation. Okay. So this station usually starts, they give you some some lab to interpret. Like in my case, they gave me CBC report, okay, with hemoglobin. And then Viva started from there. That was basically a case of anemia going for elective hip replacement surgery. So the Viva started from there, that identify what is the finding in the CBC report. Then from there they take you to the scenario and then your management and everything. It can be a ABG, it can be any lab report. Like it can be X-ray, it can be ECG.
Okay.
And then in that station they ask you each and everything regarding pre-operative. So from pre-operative they ask everything, important thing in the history, sign and symptoms, examination, and then investigation, optimization, everything. So that is station 1. Then in station 2, it's basically they examine all aspect of general or regional anesthesia and pain medicine. So in that case, they give you a scenario, but they mainly focus on the intraoperative management, that how you give anesthesia, okay. And also pain medicine. Like for in my case, they ask the pain management in cancer patient. So there is a full question regarding that. And then in station 3, they test the knowledge of ICU, and some advanced sciences question can be there, which is in the anesthesia practice. So the thing is that usually when we are preparing, we if just try to understand what examiner is asking. If examiner is asking how you anesthetize this patient, okay, then do not waste your time, from preoperative, and then because the main question is how you anesthetize. So most of the time examiner guide you. Like for me, when they asked me, when I started like in my own way, that I apply this, I do the pre-op and optimization and then pre-medication and then monitor and this, then he direct me to the, okay, I understand you will do this, but how you anesthetize the case. So he directed me towards what he wants to ask. So you have to be in you have to understand where he is driving you. If you miss that, then you would be in trouble.
So, ma'am, overall, how tough was the Viva for you? Final Viva, and
well, I feel, honestly speaking, I feel that it is it is mainly the nerve game. Okay, most of the questions were the normal average questions. Okay, they were not beyond our course
so
or
they were
something
mostly answerable.
answerable. But the main thing is that how you manage your time, how you pick the question, okay. And like it's the like I want to give you an example. If some question which is very hard and which you feel that it is not a normal question, and so most of the student feel the same, okay, that it's a difficult question, and believe me, you will not be fail in that question, okay. But if you miss a simple easy question, which most of the candidate, they answered that question, but you are not able to answer, now you can be in trouble. That's one thing. Another thing is that if you don't know anything that is very unusual, some unusual scan or some unusual ultrasound image, uh, and despite of your whole effort you are not able to identify it, do not throw anything randomly, because that happened. Like in the second day of Viva, my Viva was on first day, so fortunately I got fascia iliaca block sonoanatomy, okay, infrainguinal and suprainguinal approach. So it was easy for me to identify, and they asked me each and everything. But the next day they put sonoanatomy of gastric ultrasound.
Okay.
Okay, that is not very common. So most of the candidates were struggling in that, and many were said that we are not able to identify what is it. Okay, then their next question is, okay, what are the ways to avoid aspiration pneumonia and this and that, and then they lead from there. So apparently these candidates miss the marks of the image identification, but few of the candidate, they unfortunately they pick it as something wrong, and they said, some said it is an echo. Okay, and they explain each and everything that this is the right heart and right ventricle and this and that, and they failed them. Okay,
Okay.
they are failed, even though the same question was difficult for everyone. Some even missed that question, but because the answer was wrong, and they feel that this candidate is not safe because he doesn't know but he is answering, so he is not safe, and on safety there is no compromise. Okay. In like on both day, there are, like in my viva, the one question that I found difficult was they asked each and everything about hyperoxia. So for hyperoxia, few things we know, like some pathophysiology and some therapeutic aspect, that when we use oxygen and this, but they ask around 8 to 9 question on hyperoxia, on the cellular level, on the systemic level, then on like therapeutic option, then hyperbaric oxygen, then this decompression sickness and this and that. So I answered them with my memory, but I knew that I hadn't read that topic, so I was not very good in that. But that was unusual.
Fast enough.
Yes, but that was unusual for everyone.
Yes.
And the next day they ask each and everything about hypothermia. So at that question, everyone was struggling on hypothermia, ECG of hypothermia, raise J point, and then hypothermic arrest, therapeutic hypothermia, and this and that. So but what I feel, I take feedback from everyone, one who failed, one who passed. No one was failed because of that.
Okay.
Okay, but like you are like, candidate will fail on easy questions, not on difficult questions.
Okay. Thank you.
So
Thanks a lot. I got a very good insight.
Madam, I have one question.
mhm.
As you mentioned that there are some components from pain medicine and then there are some from critical care. As you know, in Pakistan, pain medicine, critical care, then cardiothoracic, these are super specialties.
Mhm.
And they have a very vast syllabus, which we cannot cover definitely. So what amount of knowledge do they expect? Do they expect that we should know everything regarding pain management as a FCPS pain management and critical care? Like in critical care, my colleague doing ICU specialization, they say that it is completely different from anesthesia and almost we have to study all the medicine. So what they expect in
okay.
FCAI?
Rashid, I can understand what you want to ask me. Basically, in Pakistan, we did ICU, mainly the surgical ICU. So we mainly know the surgical management in like a post-surgical patient in ICU.
Exactly.
But here in Ireland, because now I am working in Ireland, so here the ICU is not surgical or like surgical. Like there's a common ICU which has medical, surgical, all type of patient. So yes, you are right, you have to prepare separately on that for like you but it's not difficult because it's very structured. There are books related to, for the preparation of ICU part separately, and in this Elizabeth Combir, it has many ICU related scenarios. So just first you try to grip on that. By grip I mean that read one scenario, but in viva book the knowledge is question wise. There is a question, what is pancreatitis? Okay, they define it, then this and that, then take out some article on pancreatitis and do each and everything about pancreatitis, because there is no excuse if you don't know even a tiny bit of pancreatitis. For example, my question was pancreatitis, so they expect me to answer about different scoring system. Then in scoring system also they ask me that what is CT based scoring system, what is lab-based scoring system. So there is CT severity and this and that. So so unfortunately, if like I know that in FCPS curriculum, ICU is not that much extensive, but you have to cover that for the exam. Okay, but I will recommend some books. I exactly don't know the name, but I go through that book. That is for ICIMJ something, ICUIMG something. There is a book I would share. I will share.
Okay.
That is a small book. It has 30-40 ICU scenarios. Okay, so I did that book one thing, but I would say if you are just starting preparation, start from the Elizabeth, note down the topics, okay, and then take in-depth knowledge by a relevant article. uh, for like they expect you to know about community acquired pneumonia, okay, then hospital acquired pneumonia, then every detail of ARDS, then CRRT is very favorite topic. Okay, my one question was on totally on CRRT. I have never read it or done CRRT in Pakistan, but here, because I am working in ICU, I saw every other patient on CRRT, and they ask each and everything. What is the dose of CRRT? What are the modes of CRRT? How you anticoagulate? What are the, even how you anticoagulate, and how you assess your anticoagulation? So yes, this ICU part can be, tricky, but if I can do it after 10 year of FCPS, you can definitely do it.
Yeah, inshallah.
Okay, and regarding regional also, make a strategy. Okay, because regional, they cannot ask you something out of the box. Okay, there are truncal block, there are limb blocks, there are some sympathetic blocks. Okay, make a list. Okay, cover everything. Truncal blocks nowadays are very favorite. Okay, they are very fond of asking erector spinae, quadratus lumborum, paravertebral, and so they are very and not only the block, you should able to know the difference and added advantage of one block on another block. So okay, so if you answer these few questions, for example, like in last viva, not in my attempt, in last attempt, they put sonoanatomy of quadratus lumborum block. We all know that it is not very common. Okay, no one give even in my hospital there are some regional specialists, they never give quadratus lumborum block. Okay, but when you are when you don't have skill, okay, then they assess your knowledge. Okay, if you don't know how to do quadratus lumborum, or you haven't done, but if you have knowledge that this block has this advantage over simple tab block, okay, because this will cover the visceral aspect, and tab block is only somatic. If you will tell them this, okay, you are safe, because they know these blocks, we are not regional, anesthetist. So but the core knowledge should be there.
Okay, thank you.
Whenever you read block, always, you should have a book or laptop open with sonoanatomy, because there is no use if you are reading block and you don't know the sonoanatomy. And with sonoanatomy, sometimes they have pictorial thing also, like handmade diagram or something. So get yourself familiarized with the sonoanatomy or any picture, because with facial iliaca block, it was not a simple question. Okay, what is facial iliaca block? When you give it, it is like facial iliaca block sonoanatomy was there, and the structures were labeled as 1 2 3 4 5. Okay, and then they ask, okay, what is 1, what is 2, what is 3? Okay, so and the time is only 5 minutes. In this 5 minute, they start question with a patient 80-year-old, hip fracture. Your consultant want to give facial iliaca block. Okay, tell me, what is facial iliaca block? Okay, what is the landmark technique? Okay, this is the sonoanatomy, label it. What are different approaches, supra and infra and guinal? What is the advantage of supra over infra or whatever? Okay, what is the maximum dose? Okay, so in 5 minutes, you have to be very present minded to answer everything. So okay, so that's how, so that's why I'm saying that viva we all know everything. First of all, you have to believe that you know everything. The only thing is that you have to practice, and present in that frame of time.
Thank you, ma'am.
So and one more thing, always find a study partner for Viva. It's very necessary. Okay, either have some practice sessions or have a study partner, because then you can have positive criticism. As a study partner, we can criticize each other. Okay, you are weak in that thing, you should work on that. And then and that way you identify your weak areas, and then you work on that, and then again test each other. That makes you that gives you confidence building, that improves your communication skill. And then when you have a partner, there is mutual and emotional support also. So okay, so when one is down, another can support. So I was very fortunate to have very good study partners with me. And if you have family, so you have to balance with that also. Because exam is not everything, you have to balance all the aspect of your life. So for me, like, I have grown up uh, kids, but I feel that they felt that they are neglected while I was preparing. I go to hospital, come back, and then I involve in my studies. But I have to take small or short long breaks uh, on dinner table or with tea time, just to avoid imbalance in your personal space also.
I think especially as a mother, it's much harder. I know fathers can escape into the library or into their office and do their work, but especially as a mother, it's even harder to balance that gap out.
Yes, and mother always go on guilt trips also, because we have this tendency, because it happened with me. Like on weekends, I didn't go with them outside, and I was always like, no, I am studying. So that I did that, but after that, I have this guilt feeling. Okay, I spoil their weekend and this, and then I take out some time. Okay, no, I will go also. So that's the thing also with mothers, I think, only.
I think this is up to you if you want to share. Can you share your marks with what about the score? How much did you score in the final Viva?
My scoring was 3, 4, and 3. And the scoring is, I will tell you, it's like this: 4 is excellent, 3 is pass, 2 is borderline, and 1 is fail. And if you have to be pass, obviously you should take 3 in all at least. And but if you get 2, then only in one station you can get 2, that is borderline. If you get 2 in 2 station, then you will be fail. So so like 332 is pass, and 333 is pass. Mine was 343.
So with that score of 333 and 4, you were saying that if I can pass, or if I can pass this exam, you can do as well. So that's quite humble of you. And I think that's really what I would say to everyone. If one person can do it, so can the other person. It's all requires determination, planning, and practice. If you just put those principles in place, with determination, planning, and practice, nothing is impossible.
And I just want to say one thing, that I think Dr. Dikshita and Dr. Amrita is not here in this thing.
No, they're not.
But they tuned me up very well, because I know my first Viva in January when I gave, I was so I mean, I was not even answer simple questions. And with their continuous effort, the balance between Dr. Amrita and Dikshita, Dr. Amrita asks very hardcore questions, and her expressions and these things are, that is also kind of I learn a lot from that how to take pressure. Like if the examiner is asking you in a very this tone, And on the other hand, Dr. Dikshita, she was like kind of milder, and she deliberately pick up simpler question to increase our confidence. So this combination was amazing, and they actually, I really give credit to them that they prepared me very well for the Viva.
Ma'am, in each stations, there will be around 8 to 9 questions. And how many images they will display? Each question will be displayed with an image or something like that.
No, so like each station, they have 6 questions. Okay. Each questions can have 6 to 7 subpart.
Subparts.
Okay. So one question is basically a one topic. So you can say that at each station, they assess you on 6 topics. Okay. And for each topic, they have only 5 minutes. So you can imagine that in 5, if they want to assess you on diabetes in 5 minutes, so how many questions they can ask you and how quick you have to be. Okay. So that's how, like, total of total of 18 questions overall in the whole Viva, 6 at each station, and then each question has
Subparts
its,
in
yes.
each.
And regarding images, it depends. Like in my Viva, on my first table, they show me 2 reports. One is the full blood count, and then the iron study, because that scenario was on anemia. So they show me iron study, then I have to identify uh, it's anemia of chronic disease or iron deficiency anemia. Then they ask each and everything about anemia, preoperative optimization, oral iron sub, and this and that. Then in second that was of image showed to me, first station. Then on second station they show me facial sononotmy. Okay, these 2 images in my, no ECG, no X-ray in on my Viva day. But the next day they have ECG also. That was for Wolff Parkinson syndrome, and then there's gastric ultrasound and some X-ray also. So it depends.
In regional anesthesia also, questions will be case scenario. From that, they will ask regional anesthesia blocks or
Yes.
cancer management, pain
Yes.
management, or any
Yes.
sympathy.
Yes.
And there also they'll display some sonoanatomy to identify for each block what the scenario is. They will give
Yes.
some.
Yes. Usually their question leads you to the block. Yes.
blocks.
Yes.
In ICU and advanced science, how it will be? The same
Like
scenario.
advanced sciences, what I can say, like they asked about robotic surgery, so I think they included in advanced science, and this hyperoxia question, and yes, I didn't find anything advanced, because with advanced we mean that very new things that we,
Recent facts.
yes, but I cannot tell you that in my Viva what they consider advanced, because for advanced thing what I prepared was for the new definition of ARDS, global definition, that's new, and some advanced blocks like this quadratus lumborum and this thing, and but they didn't ask these things.
Thank you so much once again, Dr. Ashi, for a wonderful session. Very informative, very, very sort of detailed, and it provided lots of talking points, lot of points on which action points actually, on which people can actually work and get their preparation better. And thank you, Dr. Khushbu, for your very up-to-date summary of your preparation. I think this will help you all, this will guide all of you to get your preparation up and running. We will see you guys hopefully soon on the Academics course. Until then, Take care and have a good day. Bye-bye. Thank you again, Dr. Ashi and Dr. Khushbu.
Thank you, sir.
Okay.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank
Bye-bye.
you. Bye. Bye.